But we have to pass the bill so that you can find out what is in it.
CBS News confirms more than 2 million Americans have been told they cannot renew their current health insurance policies.
And that is more than triple the number of people said to be buying insurance under the Affordable Care Act, which the president himself calls ObamaCare. Jan Crawford is in Washington. Jan, good morning.
Good morning, Nora. Good morning, Charlie. You know, there have been estimates of hundreds of thousands of people across the country losing their current coverage, but we reached out to insurance companies across the country to find out some real numbers. This is just the tip of the iceberg. And the people who are opening these letters are shocked to learn they can't keep their current policies despite the president's assurances to the contrary. It's an unexpected reality of Obamacare, being told through anecdotes in local papers and on social media. But the hard numbers reveal the evidence is far more than anecdotal. CBS News has confirmed with insurance companies across the country that more than 2 million people are getting notices they no longer can keep their existing plans. In California, 279,000, in Michigan, 140,000, Florida, 300,000, and in New Jersey, 800,000. And those numbers are certain to go even higher. Some companies tell us they've sent letters, but they won't tell us how many.
What we're seeing now is the reality coming into play.
Industry experts like Larry Levitt of the Kaiser Family Foundation say the insurance companies have no choice.
I, too, want to join you in commending the president for his presentation this morning to us. It was one of confidence. It was one of values. That the Affordable Care Act was transformative in terms of what it meant in the lives of the American people, and that health care in our country is a right, not a privilege. If there had been no other reason for us to pass the Affordable Care Act, one compelling reason was cost. The cost to the individual, to families, to businesses, small and corporate, and to the public sector was totally unsustainable. So we had three goals. One was to lower cost, other to improve benefits, and third, to increase access. In all three of those arenas, the Affordable Care Act has been a big success.
Obamacare was communism. The people that put Obamacare together either had one of two agendas. Either they were absolute economic morons, which there's a real possibility of that, or they fully intended to destroy the health insurance industry and completely put them out of business so that the government would be the only provider of health insurance.
How would you like to see it improved?
Well, of course, I wanted a single payer and I wanted a public option, but that not being in the mix, you have to prioritize what it is you want to get over the finish line.
Obamacare has cost my tiny little company millions, with an S, of dollars already in increased health care cost, health insurance cost.
First of all, it is called the Affordable Care Act, and that word affordable is the word that we want the public to understand, the Affordable Care Act.
Now, when a little company like mine that has 600 team members is cost millions of dollars, there's a real simple effect to that. That's money I don't have to hire people with because it's going to stupidity. It's real simple. And so you want to slow down job growth.
I sat down with House Speaker Nancy Pelosi. All agree she gets credit for locking up this vote, one of the biggest since Medicare in the 1960s. And she's said to have done it with an epic blend of persuasion, muscle, and will, even when half the town said it couldn't be done.
There's great anxiety in the country about the potential cost of this bill. And we went back and looked, and in 1967, the projected cost by 1990 of Medicare was $12 billion. What really happened is it was $107 billion, which is more than 8 times what they projected it would cost. What guarantee is there to the American people that this won't similarly balloon out of control?
Well, I'm so pleased that you're asking me about cost, because the cost of health care in America, both in delivery of service and insurance to families, is unsustainable. The upward spiral of rising medical cost
can drive our country bankrupt unless we take this action now.
Obamacare is front and center today. That's because as the new enrollment season for coverage is about to begin, the administration announced that premiums will rise by 25% on average for a benchmark mid-level plan through the federally run market. At the same time, choices are decreasing. 1 in 5 consumers will have a single insurer to choose from. It's not a simple picture. Federal subsidies for most people getting coverage this way will increase.
But they didn't
That is
think
why we had to
Medicare
do
would
the
balloon out of control, and it did.
We're addressing some of the ballooning controls of Medicare and taking those down.
Blue Cross Blue Shield in the state of Tennessee is the largest insurer. They just pulled out of the exchange. What's that going to do to the economy? 1/7 of the U.S. economy is healthcare, and it just went up 62 and 44%. And this state is indicative of what's happening in every other state. It's not like Tennessee's pregnant and got a different issue than everybody else. This crap is coming down from Washington, D.C.
Evidence of governance would be how we rolled out the Affordable Care Act. It is intact. It's beautiful. As with everything, it's a work in progress. We need to improve it. But the website didn't work, and now it's well. For like $425 million were spent on ads against the Affordable Care Act. $27 million were spent on ads supporting the Affordable Care Act. That's just ridiculous. You know, it's more than, it's really incredible.
1/7 of our economy just doubled in expense to your back pocket.
We just couldn't be prouder. I believe that it's a winner. And by the way, it's called the Affordable Care Act. It's called the Affordable Care Act. I know you didn't intend any compliment or derogatory, but it's called the Affordable Care Act. Affordable. Good. Affordable. There's a reason. Affordable. 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 Affordable.
You know, you suck money out of the economy with a vacuum cleaner called socialism on some kind of trash like this. Now, that's not just an opinion. It's an actual fact. It's occurred with my company. It's occurred with thousands, tens of thousands of companies just like mine all over America.
Affordable. Affordable. Affordable.
The White House claims Obamacare helps small businesses and makes healthcare more affordable, but actual small business owners say something very different. Steve, I'm going to put up a slide here. It shows how will the Affordable Care Act affect your small business franchise? A survey of small businesses. 64% said it had a negative effect. Steve, why?
That's amazing, isn't it? And by the way, all the Obama administration needed was more bad news about Obamacare. But you're right. This was one of the central promises that was made, Mary, back in 2008 and 2009, was that we would have Obamacare and small businesses would love it. It would make insurance more affordable and easier to find. And now we're finding exactly the opposite, that when you actually ask people who own small businesses, the employers in this country, by about a 10-to-1 ratio, they say that it's a negative for their business rather than a positive for their business. This is a big problem. Let me just add one other thing, Mary. The poll also showed that you've already got nearly a quarter of all businesses, between about 40 and 200 workers, that are saying they are moving to part-time workforce because of the new mandates under Obamacare.
Why is it that this bill has been so unpopular? Did the Democrats blow it in messaging?
The Republicans spent, you have to remember, the health insurance industry and their allies spent over $200 million mischaracterizing the legislation. We were busy writing a bill, gaining compromise and the rest. They were putting, we could stop what we're doing and try to go raise $200 million. We don't have their special interest resources. But that was a characterization that is hard to undo. But now that the Supreme Court has acted, you see the momentum is with us. It's a big change in terms of public perception
of the legislation. I think that will only get better as people enjoy their benefits.
Looking at growth in healthcare costs. So this is not premium growth. This is the underlying costs. And what's happening is you're seeing a chain reaction. There has been, since the Affordable Care Act passed, $50 billion in mergers in primary care providers, so hospitals. And what we're seeing right now is insurers are trying to keep up that growth. There was a brief dip because of the recession. You see that spike there in 2014, right after the marketplaces kicked in. The long-term trend, however, is going to continue to climb. People are getting older. More people are acquiring insurance. There's a lot more money in that pool.
And it's way above inflation. I mean, the real growth within the sector is breathtaking. What does that say about the Affordable Care Act?
Well, it seems like there are two problems to fix in health care. One of them is making sure that people are covered. The other one is dealing with runaway costs. So we have addressed one. There is a lot more to do to address the second, which is runaway costs. There were some experiments in the Affordable Care Act. Some of them have borne fruit, changing the way people provide coverage. You know, we really haven't addressed this huge problem. You know, as I think everybody at the table knows, our healthcare spending per capita is beyond all proportion of any other country.
The president in a statement said today his health care proposals were defeated because he didn't have the cooperation of any of the Democrats and some of the Republicans. No, he has never really been about increasing access, lowering cost, improving benefits. That's what the Affordable Care Act is about.
Nancy Pelosi became a member of Congress through a special election 30 years ago. She has led House Democrats for the last 14 years, including a stint as the first female speaker.
Right now, our fight is about the Affordable Care Act. I've always had a challenge in the caucus right from the start. Because I'm a master legislator, I'm experienced in terms of knowing the institutional memory of the Congress. If Hillary Clinton had won, I might have gone home. But with Donald Trump in the White House, with a Republican majority in both houses, no way.
You said you're a master legislator. Let's see your sense of where the Congress is. What kind of bill will come out of the Senate? And we know that. Will the president and will the Republicans get enough votes in the Senate to pass it?
I don't think anybody knows that right now. Maybe Mitch McConnell does. But right now, at this moment on Monday, we haven't seen the CBO report yet. We do know that the many more people, millions, hundreds of thousands of people will die if this bill passes.
But you don't think there's room to fix this legislation? You're saying out of hand.
No, let me be very clear, and thank you for that question. The Affordable Care Act, we can work together to
Republicans and Democrats can fix it.
Absolutely. And that's what we had hoped that President Trump would want to do from the start, instead of sabotaging it. Some of the ills of it are because of the Republicans when they took power, not renewing some of the things that were in there.
It's just, you can't do it politically. You just literally cannot do it. Okay? Transparent financing, unless I have transparent financing, also transparent spending. I mean, this bill was written in a tortured way to make sure CBO did not score the mandate as taxes. If CBO scored the mandate as taxes, the bill dies. Okay? So it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass. And, it's the second best argument. Look, I wish Mark was right. We can make it all transparent. But I'd rather have this law than not. So it's kind of like his reporter story. Yeah, there's things I wish I could change, but I'd rather have this law than not.
So first of all, you haven't publicly commented on this so far. Do you stand by the comments in that video?
The comment in the video were made at an academic conference. I was speaking off the cuff.
Our bill brings down rates. I don't know if you have seen Jonathan Gruber of MIT's analysis of what the comparison is to the status quo versus what will happen in our bill for those who seek insurance within the exchange. And our bill takes down those costs even from now, and much less preventing the upward spiral. So again, we're confident about what we set out to do in the bill: middle class affordability, security for our seniors, and accountability
to our children.
On health care.
On health care.
Speaker Boehner made it clear last week they're probably going to have multiple votes in the new Congress on health care. We have the news here in the past few days about some of the comments made by Mr. Gruber, which has sort of united that side, and they're talking about possibly having hearings and calling him up to talk about what he meant and the architecture behind this. Tell me, how does your side engage on this issue in a different way with them going back to this well again? And what does that mean? Does it give you more opportunity, or does it continue to defend it, or is this just, you feel like you're fighting the same battle over and over?
Well, you gave an interesting set of observations, but one that you skipped is that Mr. Gruber's comments were a year old, and he has backtracked from most of them.
But that still engaged them, regardless.
Nonetheless, you didn't have it in your narrative. And that's really important, that he doesn't. He's not even advocating the position that he was at some conference and said. So I don't know who he is. He didn't help write our bill, and so.
Professor Jonathan Gruber is considered by many as the architect of Obamacare. As a former Obama administration official put it, Professor Gruber was the man on Obamacare, the guru of health care. Professor Gruber is often said in Washington to be the definition of a gaffe. That's when somebody accidentally tells the truth.
All due respect to your question, you have a person who wasn't writing our bill commenting on what was going on when we were writing the bill, who has withdrawn some of the statements that he made. So let's put him aside. But to your further question, which is more important, and with or without him, the Republicans will try to undermine the Affordable Care Act, and we recognize that.
John Kerry, from Republicans, more likely staff, came up with a great substitute idea. They said, look, what you economics nerds want to do is you want to say that for people with expensive health insurance plans, they will no longer get a 40% tax break. What if we instead just levied a 40% tax on the insurance companies that sell these terrible expensive Cadillac plans? We said, well, that's pretty much the same thing, but why does it matter? We said, you'll see. And they were both in, and that passed. Because the American voter is too stupid to understand the difference. Okay? So basically...
I was speaking off the cuff, and
until a second Massachusetts hero arose, John Kerry. And John Kerry said, no, we're going to tax your health insurance. We're going to tax those evil insurance companies. We're going to impose a tax that if they sell health insurance that's too expensive, we're going to tax them. And conveniently, the tax rate will happen to be the marginal tax rate under the income tax code. So basically, it's the same thing. We just tax the insurance companies. They pass it on higher prices. That offsets the tax break we get. It ends up being the same thing. It's a very clever, basically exploitation of the lack of economic understanding of the American voter.
So this was the room where President Obama called you. The two of you talked in here last night. What did you say to each other?
It was pretty exciting for both of us. Many presidents since Teddy Roosevelt have tried to pass health care reform for Americans, and many speakers of the House have tried to do it as well. And last night we had that level of success.
The Department of Health and Human Services, which spent $500 million to build the site, is admitting it's a bust. Writing in a blog post, we know using healthcare.gov has been frustrating for many Americans. They're also calling in a new batch of workers to address technical glitches and problems that have plagued the site since its launch October 1st.
This is unacceptable. It has to be changed. But any system that deals with that many millions of people frequently does have a glitch.
So far, 19 million people have visited the site, reporting issues like confusing error messages, broken calculators, wrong information on Medicaid eligibility, and long delays in timeouts.
But even when we tried to access the site, we encountered this error, a registration page filled with question marks and incoherent data.
I told him that I was certain it would not have happened without his vision, without his commitment, his unwavering commitment to making comprehensive health insurance reform the law of the land.
As you know, there was such vitriol around the Capitol and also inside the room last night. We heard people saying this is Nancy Pelosi's one-party rule.
We all claim it
But words
as
matter in political discourse. You know that. The president was adamant saying the individual mandate is not a tax. Well, in fact, his own Solicitor General went to the Supreme Court and said This is constitutional under the taxing authority of Congress.
That's right.
So
And
that's
you
not how
you
this was
said
sold to
exactly-
the American. But this
Yeah.
is not how it was
No,
sold
it's
to
a
the American
penalty.
people.
No, it's a penalty. It's a penalty that comes under the tax code. It's a penalty that comes under the tax code. It's a penalty that comes under the tax code for the 1% perhaps of the population who may decide that they're going to be free riders. But most people are not
But it's a
affected
new
by
tax.
No,
It is
no,
a new
but-
tax
no,
on the
no,
American
no,
people.
No, no. It's not a tax on the American people. It's a penalty for free riders.
Affordable Care Act tax penalty explained. Under the Affordable Care Act, if you can get health insurance and choose not to, and you aren't exempt for any other reasons, you may have to pay a tax penalty. The tax penalty is calculated based on a percentage of your household income, or a per person or per family rate, whichever is higher. For the 2014 tax year, the tax penalty amount is either 1% of your household income or $95 per uninsured adult and $47.50 per uninsured child, up to $285 per family. In 2015, the amount increases to 2% of your household income or $325 per uninsured adult and $162.50 per uninsured child. In 2016, this amount increases again and adjusts for inflation every year after that. The penalty amount is also based on the number of months you or your dependents were uninsured. If you're uninsured for less than 3 consecutive months, you won't have to pay a penalty for that time period. This is called a short gap. If you have more than one short gap in coverage during the year, your penalty exemption only applies to the first gap. When you file your tax return for the year you were uninsured, your tax penalty will either be deducted from your refund or added to your tax bill. By law, the IRS may not use liens or levies to collect Affordable Care Act tax penalties, but they may take the penalty out of your expected tax refund. Still have questions about the Affordable Care Act tax penalty?
Shame on this body. Shame on each and every one of you.
We heard the Minority Leader Boehner say, shame on you, shame on you.
Well, you know, some people will do anything for the insurance companies.
The White House is stepping in once again when it comes to the way Obamacare is being implemented. First, it was a decision to delay the employer mandate, and now the president has personally intervened to allow the government to continue helping members of Congress and their staff when it comes to paying their premiums. Members of Congress were furious that they would soon be forced to pay thousands of dollars.
Members of Congress, Harold, were furious that they were going to be held to the same law that they passed, right?
It's odd.
It is odd. They got so
There's
angry.
a lot of odd
And by the way, so the
things
president goes up to see the Democrats this week. What is the first thing, Mike, they're yelling at him about?
What about my premiums?
Exactly. You mean we're going to have to live by the laws that we passed on to the American people?
Oh, we're going to have to worry about the same things that our constituents are forced to worry about? Please.
I'm sorry, Mika.
No, actually, they take their vacations when they're
5 weeks.
Yes, okay.
5 weeks.
Usually when things are just like happening, they leave.
I think that's the Minority Leader's motive.
Yes.
Is that John?
Yes, I do.
His entire motive.
Well, I think his motive is that there will not be an expansion of health care for all Americans with a government involvement in regulating the insurance companies. But you'll have to ask him about his motive. I really don't question people's motivation.
For many, their introduction to the Affordable Care Act has been negative. A broken website and now cancellation notices from insurance companies, followed by sticker shock over higher prices for the new plans. Is directly at odds with repeated assurances from the president.
If you like your insurance plan, you will keep it. No one will be able to take that away from you.
But people across the country are finding out they're losing their existing insurance plans under Obamacare. That's because requirements in the law, like prenatal and prescription drug coverage, mean their old plans aren't comprehensive enough. In California, Kaiser Permanente terminated policies for 160,000 people. In Florida, at least 300,000 people are losing coverage.
When I got this bill, I was outraged.
That includes 56-year-old Diane Barrett. Last month, she received a letter from Blue Cross Blue Shield informing her as of January 2014 she would lose her current plan. Barrett pays $54 a month. The new plan she's being offered would run $591 a month, 10 times more than what she currently pays.
What I have right now is what I'm happy with, and I just want to know why I can't keep what I have. Why do I have to be forced into something else?
And any bill
that is passed, you see implementation and you know how you can improve it.
Mr. Speaker, the President's health care plan is broken. Let me read from some of the letters and communications my office is getting from around my district. Mike and Pat in Queen Anne's County write, Mr. Harris, my daughter's health care premium just rose $648 a year, thanks to the Affordable Care Act. Don't you or other Republicans give up the fight.
And everybody will have lower rates, more, better quality care, and better access.
Cindy from Talbot County writes, I've just discovered that I can't keep the medical insurance I've had for many years, as it no longer exists thanks to Obamacare. Even though I'm 58 years old, I must pay for maternity benefits and pediatric dentistry when I have no child under 19. I get an increased deductible and a premium increase of $143 a month. What a mess that needs to be fixed, and in a hurry. And finally, Lorraine from Queen Anne's County writes that she called our office in tears. She was told by her insurer that her premium was just increased $256 a month. Her total payment that she and her husband now is $956 a month. And her insurer told her that it went up because of Obamacare. Mr. Speaker, the President's health care plan is broken.
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.